More insight, NBC News medical contributor Dr. Natalie Azar. Dr. Azar, good morning. So a lot of people talking about it on social media. Is it safe? Is there any downside, assuming you can afford it, to taking something like this?
Well, so first of all, let's just set the framework again off of Kristen's piece. This is for type 2 diabetes. We're talking about Ozempic. For type 2 diabetes, it regulates your blood sugar, but it also targets that area in the brain that sends the signal of feeling full or not, right? So it's definitely helpful for weight loss. And importantly, for type 2 diabetics, it can also reduce the risk of cardiovascular events. But here's the thing. It's expensive, right? We said $900 a month. Experts say that you would need to take the medicine kind of indefinitely because once you stop it, you theoretically can regain all of that weight. That's key. You mentioned side effects. There are side effects that can be associated with it. They include nausea, vomiting, but also more serious things like pancreatitis, acute kidney injury, gallbladder problems. So it's not without potential risks.
So do you think, I mean, if you had a friend who said, look, I'm thinking about using this, I just want to drop 25 pounds, do you think it's safe enough to say, well, it's not going to harm you, you can go ahead and do it?
Well, here's the thing. It can potentially harm you, right? And this gets into the whole topic of using a drug off-label.
Right.
The FDA studied this drug and its sister drug, Wegovy. There's another drug, it's the same, active ingredient, but Wegovy is marketed actually for weight loss for people who are obese or overweight who have one health-related condition like hypertension or high cholesterol. But the FDA studies the drug in that population. The FDA hasn't studied the drug in people who aren't diabetic or overweight.
So for the Wegovy thing, like that is for weight loss, but is it the notion that, well, whatever risks that you mentioned are outweighed by the risks of obesity and those kind of health issues?
Exactly. And of course, like anytime, the big issue here is how are folks getting this drug, right? I mean, if you're not diabetic and you're not obese, how are you actually accessing this? And that's important because—
How are they?
Yes, well, I mean, we were just talking about this. There's websites and and obviously some people are obtaining prescriptions, inappropriately. Anytime you prescribe, and we do this, I do this in rheumatology. We do prescribe medications off-label, but there has to be shared decision making, and the patient has to understand that potential risks can happen at the discretion of the provider.
And I think your point about how it only lasts for as long as you take it is kind of a big thing. Like once you stop it, you put the weight back on?
Potentially, and then experts say even you could gain even more because remember, it's regulating insulin secretion and it's affecting hormones. It's not necessarily something that's going to reset you for life. And remember, with Ozempic, I think the average weight loss was about 14 pounds. With Wegovy, it's higher. It's about like 15% of your body weight. But again, for people who need this medically managed weight loss, it is a wonderful tool in the toolbox. But the shortages are real, partially supply, but how much of this is playing into it? The FDA has both Wegovy and Ozempic on the list of in short supply drugs at the moment.
All right. Good information, Dr. Azar. Thank you so much. Al,